Hi, MPA families and students. Hey, it's Mr. Brian. Welcome to our MPA Town Hall before school starts. Who's ready for school? We are. So tonight we're going to share what we know as of this point. We've done 2 town halls over the summer, and every time things have been changing, but it's been changing for the good for us. We're getting that much closer to starting. And tonight we got lots of information to share, so thank you for joining us. I just want to keep you in mind that you're seeing this on YouTube. Use the chat feature. I have a couple staff members going to help us collect questions. We also plan to send out a Q&A answer sheet by Friday. And then all the questions you've been asking us over the summer have been we've tried to address it into our own MPA restart plan. So that big document, not as big as Jeffco's, but that big document, there's a few updates I'll show you tonight that we haven't put in there. We'll update it again next week. And it's really kind of our living document as we go. So again, thank you for joining us. We'll have this stream available. Mr. Brandon here says right after we're done tonight on YouTube. So remember, we're handling this pandemic with grace and courtesy. That's what we do here at Montessori Peaks. That is our way of being, and I couldn't be happier to have the staff back in the building. We have figured out how to work together in this new environment, how we have to change how we meet, we have to change our habits, everything, and it's just been a joy, and we can't wait to have your kids with us. Here's the agenda tonight. I'm very pleased to have Children's Hospital with us tonight. They're our health partners. We contract services with them. And wow, what a support they have been. It just helps us balance out all the information that we get on how to start up schools. So they're going to be talking to us tonight. They'll be with us for about a half an hour, and I'll introduce them in a minute. I'm going to have Jack Llewellyn, our MPA board president, talk and kind of give a little bit of an update. And I tell you what, that board is super committed to us being in person. We had a meeting last night and we are ready. The board's backing us. We are a charter. As long as we don't have health orders that close us down, we have our own direction moving forward at this point. So we're very excited to have their leadership and guidance in this. I'll give some updates on the restart plan. And then I have Miss Heidi here tonight, Miss Jennifer, Miss Ashley, Miss Jana, and then we'll do questions and answers at the end. So thank you. Hey, Jack, do you want to step in right now and say something on behalf of the board? Okay, no worries. So real quick, I love this baseball picture from 1918. I'm a huge baseball fan, big Rockies fan, have lots of memorabilia. I did that video on it over the summer. But this picture reminds me that we'll make it through. They had to wear masks 100 years ago. We're wearing them now, but at some point, life will change again. So it gives me encouragement, gives me hope that our generations before us handled it, we can handle it as well. So that is doing our part. That is kind of the tagline. If all of us do our part, we're able to keep MPA open and in person. And we're also going to do our part in the remote world. We've improved how we're going to deliver that, and we're excited to serve those families in 2 different learning environments. If someone would ask me, was that possible a year ago? I would have said, what? But it is reality, and we are ready for it. And I'll give you the updates on that as well. So before I get too far, I want to introduce Kelly Brown. She is a partner from Children's Hospital. She works with Christine in the nurse's office here. And her and
Dr. Cataldi.
Yes, there we go, Kelly. Take it away. And I'm going to start sharing because you have a PowerPoint.
Yeah. So I'm Kelly. I'm the children's nurse. I've been working with MPA for a little over a year now, I think. And I've loved getting to know the families and the students. Maybe you've seen me in an IEP meeting or if involved with any medications. So I really love the community and I'm happy to be helping you guys through COVID. Today we have one of our doctors, Dr. Cataldi. She's with our infectious disease team who has a presentation for families and parents about getting back to school with COVID. So I can introduce her now. Dr. Cataldi, if you're ready for your presentation.
Yeah, thank you so much, Kelly. So I'm happy to join you all tonight. I'm going to share some information about COVID in schools in particular, and hopefully share some information that will help complement all of the detailed plans that your school has spent a lot of time putting together. And I just love hearing the spirit of grace and being prepared for change, because I think that's hugely important, as we've all learned over these past few months. So before I start, I'm a pediatrician. I'm a specialist in pediatric infectious diseases and have been helping support our COVID-19 response from Children's and doing a lot of work with community pediatricians, as well as with lots of the groups across the state who've been planning for schools. So I'll start with just a little bit of review of things you might see in the news. Just like the actual situation with COVID changes all the time, it seems like there's a news story about some new research study every day, and sometimes it can be hard to know how to interpret them and how to get beyond the headlines. So focusing on schools, one thing that's gotten a lot of attention in the news is what happened to schools in Israel. And it didn't go well for folks in Israel, unfortunately, but I want to break down maybe why that happened and what we could learn from it. So we know that in Israel, they had gotten their case numbers down really far, and then they opened schools up, starting with younger kids, so primary schools or elementary schools, and things seemed to go okay. But after a week or two, they then opened middle schools and high schools, bringing in older kids. And they also relaxed some of the guidelines around things like masks, distancing, and schedules. And it also seemed like people started to ignore those, started to get more comfortable. Finally, a heat wave came, and we're talking like over 100-degree heat in the country. And the government actually said, okay, you know what? It's so hot that students and teachers, you don't have to wear masks. And so for 4 days, nobody was wearing masks. And then they really saw all of the numbers skyrocket. So there's a few things that went wrong there. I think the idea of relaxing the rules or removing some of the rules that people had spent so much time planning. And then also this problem with just saying for a few days, everybody could go without masks. So I think that hearing that something went really badly somewhere can be scary, but understanding why is really important. Another story that got a lot of news coverage was a publication from some pediatric hospital doctors in Cincinnati. And these are really great pediatricians, actually. They did a study that looked at the different times that each state across the US closed schools back in March and a couple into the very beginning of April. And what they showed was that the states who closed schools early did better than the states who closed schools later. And those states who closed schools early saw the biggest drop in their COVID cases and in the deaths from COVID. They also noted, though, that it's hard to really control and say, oh, this was all because of what we did closing schools, because I think we all remember in March, it seemed like schools were closing, then restaurants and bars and workplaces and travel was stopping, and things happened really quickly one day after another. So it's really hard to say that all of these changes in COVID numbers they saw were because of schools. Even knowing all that, we know that this study really only tells us what happens if you close schools when there's lots of COVID going on. It doesn't tell us much about opening schools, and it definitely doesn't tell us much about opening schools with all of the careful plans and changes in our lives that we've made around distancing, hand washing, masks, and changing some of the things we do with our school schedules or the way that we have groups of children together. This is another study that got a lot of news about this sleepaway camp in Georgia where there were over 200 kids who got COVID. So again, really scary headline. This study was published by the CDC, And what they saw is that at this camp, they started with a couple weeks of training for the staff. So young adults and teenagers came in to do training to be camp counselors. And then the younger kids came after that, the campers arrived. It was a staff member, so one of those teenagers or young adults, who was the first person who was recognized to have COVID. After they saw what happened at the end and started getting more information, they think that probably several of those teenage or young adult staff members had COVID when the campers arrived. At the end of it all, almost half of the kids who were at the camp, and that includes both the older counselors as well as the campers, did test positive for COVID. So that's a lot, and that's pretty scary. But I want to think about how this is very different than school. So first of all, we know that at sleepaway camp, you are spending much more time together with groups of other people because you're sleeping and eating all of your meals together 24/7 for the whole time that you're there. We see this with outbreaks of other kind of infectious diseases, even before COVID, that places like camps, hostels, military barracks, cruise ships, those are the kind of places where infections can spread really quickly. And although it seems like schools could be sitting in a classroom forever, it really is a different amount of time in a different environment. We also know that the campers in these cabins in Georgia didn't wear masks, or at least didn't have to, even though the staff, so those older teenagers, did. The CDC points out that there's a lot of singing and cheering, which we know is a risk activity if you have COVID, that you spread it more when you're yelling or singing. And then there were also large numbers of kids living in cabins together without ventilation, which sounds really hot in the summer in Georgia, but also is not great for the spread of COVID. And finally, this all happened in Georgia in the summer. And I think we all have noticed that Georgia, like Texas, Florida, California, those are states where their numbers were really getting a lot higher in the summer, even as we here in Colorado have been lucky to have some improvement in our numbers. So this all happened as Georgia was seeing lots of cases in the community. And then finally, this one made me very cranky this weekend. This was a news story that the New York Times put out. And it was, what they're trying to do was really cool. So they used information from state and county health departments to see how many cases of COVID were happening over the past few weeks, and also what was the percent positivity of PCR tests in the state. And so there's some suggestions that once you get each of those numbers low enough, that can help you decide how safe it is in your community to do something like open school. The problem is when they published this over the weekend, Colorado was all red. You can see in the map now, it's yellow and green, which means you can start opening schools, at least taking precautions if you do it. So what they had when they published it this weekend is they didn't include the right information for PCR positivity in Colorado. So that means everybody across Colorado who goes and gets that nose swab test, their first map said that almost 7% of people were positive, and that's not true. For the past few weeks, we've really seen 2 to 5% positivity. And this past week, we've seen 2 to 3%, which is really good. That's where we'd love for things to stay. And that makes it a lot safer for us to open schools. So thankfully, they updated this yesterday, or I think maybe this morning, yesterday, with accurate information. And so if you're interested to learn more about how different counties across the country are doing with opening schools, this is kind of an interesting article. We'll spend a little time on testing, and then we'll talk about what it's going to look like thinking about symptoms in schools. So just to understand the different kind of tests there are for COVID, because it can be confusing, the biggest categories are PCR test, the antigen test, and the antibody test. So I put some pictures up here to help understand how the tests are done. I think that's the biggest thing that matters for most kids who have to get a test. A PCR test and an antigen test are both almost always done with a swab in the nose or in the throat. An antibody test is a blood test, so a needle stick either in your arm or sometimes with a finger prick if you're lucky. So what is it looking for? The PCR test is looking for RNA, which is like DNA, from the virus. The PCR test is the most reliable way to know if somebody currently has COVID at the time that you put that swab in their nose or their throat. One of the cons of the PCR test, one of the downsides we know, is that sometimes it can take longer to get a result back. These have to be run in a lab almost all the time. So they have to be done either in a hospital lab or sent out to a lab company that does tests. And usually that means sending it to sort of a hub where that lab company runs all of the tests together. The other con I should mention, of course, is that the swab is not comfortable, which we all recognize and hope for better ways in the future. The next one, the antigen test, this is also a swab. It's looking for virus proteins. So instead of looking for the RNA or the DNA of the virus, this is looking for proteins. It's often faster than a PCR, and some of these can actually just be done in a clinic. So some of these can be done right at an urgent care or in your doctor's office. The problem is it's not as reliable as a PCR. So you can have many false negatives. So you can miss the virus, even if it is there. And I'll mention in just a moment, you can also, on occasion, have some false positives. So an antigen test, although it's fast and sometimes easier to get, if it's negative and somebody's really sick, probably still need to get a PCR test just to be sure. The last one is the antibody test. So this is a blood test. I put the biggest pro here is that you don't have to get a swab in the back of your nose. And then the trouble with this is it doesn't tell you if you have COVID right now. What it tells you is, do you have antibodies to the virus, so proteins in the blood that say your immune system has seen this virus before? You can have false positives, although the newer tests, that's less of a problem. And then unfortunately, we don't know how much those antibodies actually protect people from COVID in the future. And the protection they do provide, we don't know exactly how long it lasts. That's something that we'll just have to keep learning over time as we have more time to learn from this disease. It's hard to believe, but it's been 6 months since we've been learning about this disease here in the US. And so we just need time to see how long that protection might last. Couple more things on tests. So other categories of tests that you may hear about are rapid tests. So rapid just means it's fast, and most often it means it's not done in a lab. But these can be PCR tests or antigen tests. And what really is more important is whether it's a PCR or an antigen or an antibody, not whether it's rapid or not. So we have some rapid tests in our big lab at Children's, for example, that take 30 minutes, but they still have to be done on a machine in a lab in a hospital. So if you are in our hospital, that's great. Or if you're in the emergency room, you might be able to get an answer faster. But if you're sitting in a pediatrician's office, you're still going to have to send the sample to the lab where the lab can do it quickly. Home tests are getting a lot of press lately. Most of these are also rapid. Most of these are something you would put in your nose or in your mouth and get saliva or get a sample from inside your nose and get an answer quickly at home. Some people will talk about how they look like a pregnancy test almost. You get a line that tells you the answer. Many of these are antigen tests. So remember I said sometimes that antigen kind of test is not as reliable. Some of them use other methods that are related to antigens. Most of these are not as reliable as PCR, unfortunately. You can have false negatives, which means you miss the virus if it's there. And then you can also have false positives. So I made a note here to see celebrity examples. I'm not sure that how much people have followed this, but there's been a couple NFL players. I don't think any of the baseball players, and then the governor of Ohio, who have had false positives where they get tested because they're testing everybody before an event or testing everybody on a football team before practice. And they say, oh, you're positive, you have to go sit out. And then when they repeat it and do a PCR, it turns out to be negative. So that is a note of caution with those home tests and those rapid tests. These rapid tests, though, or these home tests are probably something that we will start using maybe 3 to 6 months down the line, because they could be really helpful if you could get enough of them out to a really big group of people to be able to do every day, even when they're not feeling sick, so that you might catch people before they get sick. If you're doing it among a lot of people that way, and you're doing it just to try and catch people early, the reliability issues can kind of spread out over groups and become less important, but you still need to go get that PCR test if you're feeling sick and to confirm any results that you might get from the rapid test. The last one is saliva tests. So this was really good news over the weekend that this saliva test got approved. It was developed by Yale and was also developed in cooperation with the NBA. It's a PCR test, so it still has to be sent to a lab, unfortunately, but as a PCR test, it's very reliable, doesn't have those issues with false positives and false negatives that I talked about with some of these other rapid or home tests. You collect a small amount of saliva, put it in a tube, but then it still has to go to a lab. So it's really nice because you don't need the swab, which means it's not as uncomfortable. And then it's also nice because sometimes people have run into issues with supplies of stocking those swabs. So it does help with some things, but because it still has to get to a lab, it means it's not really a rapid or home test, and it doesn't solve that issue. Trying to advance my slides. There we go. So how to think about COVID in school. So as we prepare for back to school, I think it's important to also notice that there's probably going to be change over time and to be ready for that. And so the decision you're getting ready for tonight is something that might change over the coming months or in the second half of the school year, or if, let's hope not, we're thinking about this again next year. So some different ways you can think about school include thinking about how much COVID is in your community. So thinking about if there's lots of COVID out in the community, that risk of COVID in school is going to be higher. Also thinking about what is the risk of COVID at school. And that's where hearing about what plans you have in place at your school are really important. We'll talk about some of that later on. Thinking about your child's own risk of COVID is also really important, and that's something that all parents have been thinking about since the beginning of COVID. So a child who has a medical condition, their family might think differently about getting back to school than a family who has a healthy kid who's never had a broken bone or had to be in the hospital in his life. So that doesn't mean that a kid with a medical condition can't go to school. It just means that you should talk with your doctor about what that condition means in relation to COVID, and also think about extra things that you could do to help keep them safe in returning to school. Related to that is your family's risk of COVID. So maybe your kids don't have any medical problems, you're not so concerned about them, but if one of your children did get sick and get exposed to COVID at school, how would you think about that situation with your child being back at home? People who live with somebody older or someone who has, cancer or a transplant might think differently about the risk in their household and might want to approach things with school in a different way, and probably want to approach the decisions that they make about COVID in general with a little more caution than other families. And then finally, challenges with remote school. Everybody's experience with remote school has been different. Some of it's related to the school, but a lot of it is really related to each child and how each family can react to it. So we know that children have different educational, developmental, as well as social and mental health needs. And some of those are really challenging to meet with remote schooling and really are better served in person. All of that is why we all have been working so hard to be able to get back to in-person learning, but recognizing that it affects different kids and different families in different ways. Also noting that some families may not be able to give kids the supervision and support that they might need at home when we do have times where remote learning is going on. So I think these are probably things that have gone through your mind, but I like to call them out and present them as a framework of how parents, families, and teachers can think about the different factors that they need to consider when they're making decisions around school throughout the school year. And then I think going back to the very beginning, thinking about how these might be different for other families around you and being able to respect the decisions that they might make about school, again, with that approach of grace and kindness and also flexibility. So what are the things that we can do to keep people safe from COVID at school? So one is hand hygiene. I've been talking about that ever since the beginning of COVID. You can think about sending hand sanitizer to school with your child, or seeing what's going to be available at school and what the plan is for making sure everybody's hands are clean. Distance. I want to talk about distance because we've done a really good job of hammering 6 feet into people's heads, but I'm here to tell you that 6 feet isn't magic. So we know that the droplets and particles that we can spread from our mouth and nose that can carry COVID, they travel over distance, and they also spread out the further that they get away from a person. So when you think about that, any distance you get further from someone those particles are going to drop, and also they spread out. And so they become less dangerous and less contagious as they spread out. So 4 feet away from someone is better than 3 feet. 3 feet is better than 2 feet. And 6 feet really isn't magic. There's countries around the world that use 1 meter or 1.5 meters. So we translate that, that would be 3 feet or 4.5 feet. And they have signs all over that are 1 meter, 1.5 meter. So just knowing that 6 feet is great when you can do it, but the whole point of masks is that's what you do when you can't be more than 6 feet away from somebody, and just the more distance you get, the better. Face coverings, we'll talk about that in a moment. Vaccination, just want to mention, we have flu season coming. The thing we're all really worried about at the hospital is having flu season and an increase in COVID happen at the same time. So making sure that your children are up to date on their regular care, getting a flu shot for you and your family when you can. Symptom screening, we'll talk about what that means in a moment, but really checking for symptoms every day, keeping children home when they're sick, and also working to make sure that school staff is doing the same thing. And that's, again, what your school's been working really hard to plan for. This is certainly not the year to say, oh, you know, I think I'll just give them Tylenol before they go to school to keep the fever down. We all need to be serious about checking for symptoms and be honest about what's going on, because that's the only way this will work. We have to trust each other and trust that families are going to approach this in a safe way so that we can all keep kids in school. And then finally, pods and cohorts. This will look different at every school and look different for every age. But the idea of pods, cohorts, or groups is that by being around fewer people for long periods of time, you decrease the risk that any one of those people might be sick on a given day. The other thing about pods and cohorts is that by keeping people in a group that spends most of their time together, if someone in that group does get COVID-19 or does get sick, then it's just that group that you need to think about, okay, who might have been in close contact and who might need to stay home for a while. Whereas if kids are in one group for 3 hours and then a different group for 3 hours and then a different group for 3 hours and a different group the next day, and they get sick, you're going to have to think about all 4 of those groups as you see who else might have been in contact. Talk about masks and face coverings for a moment. So we know that the state order in Colorado is that anyone over age 3 needs to wear, anyone over age 10 needs to wear a mask when they can't keep away 6 feet of distance and when they're outside of the home. We also know that children younger than 10 years can keep schools safer by wearing a mask when they also are unable to keep that distance. And the rules will be different for each school and at different age levels and different situations. But I just want to point out that difference between what the state mask order says and what we know kids can do. We've seen lots of kids learn how to wear face coverings, pick out their favorite mask with their favorite design, wear their face coverings when they're at summer camp programs or going to the grocery store. So we know kids can do it. So who should not wear a mask? We know that children under 2 years of age should not wear a mask. Anyone who's having active trouble breathing. So this would be like an asthma attack or a flare. I mentioned that asthma and chronic lung disease, when they are just stable conditions, are not a reason to avoid masks. I put the example here that some people who have cystic fibrosis or immune compromising conditions like cancer or even really bad chronic lung disease, these are people who've actually taken to wearing masks in years past during our flu and respiratory season because they're trying to protect themselves so that they don't get sick. So we know people who have a chronic breathing issue can wear a mask just fine, but if you're having an asthma attack or a flare, you probably should call your doctor about that anyways to check it. Any child who can't remove a mask on their own, so these would be children with neurologic, developmental, or cognitive disorders where they just can't really remove a mask if they were having any trouble breathing. They should not wear a mask. And then any child who has a history of severe trauma that would be made worse by a mask. So this would be things like a child who was ever in a situation where they had their mouth covered and couldn't breathe, or couldn't breathe for any reason, again, where covering their face with a mask would maybe bring back that trauma and really make them have a difficult time. For children who have anxiety or autism spectrum disorder or sensory conditions, these children may be able to wear a mask if you work with a therapist, like a behavioral occupational therapist or if you have a mental health therapist that you think would be helpful, to try and think of strategies. One is just to practice wearing the mask. One is to wear it for a short period of time and kind of have an end point on it. Another is to remind the child that the mask is something that they have control over. So a child with anxiety or with sensory condition, that might be something that's helpful for them, is talking about, it's okay that at the end of class, you might need to go outside and take a mask break, and then working with their school and their teacher about how you might be able to really build those skills of wearing a mask. The other thing is to find the right mask. So everybody knows that some masks are uncomfortable, some masks are more comfortable than others. Some children might be very bothered by the ear loops and might prefer something that ties. Again, just working with kids to see what works for them. Oh, sorry. So, life outside of school. I think it's really important to remember that everything we do outside of school also poses a risk of exposure to COVID-19. So thinking about the things you do outside of school are really impacting your child's ability to stay in school. So being around lots of people, whether it's a big event or through sports activities, or eating inside at a restaurant, each of those interactions increases the chance you could be around someone with COVID-19. So just remembering that also those things you do outside can contribute to the level of COVID-19 in the community, and that can pose a risk to what's going on inside the school. So remembering that everything that's been worked really hard to try and control the situation in schools also relates to what's going on outside. Just share this graphic because I think it's a really nice representation of the things we've all had to learn over the past few months. People ask sometimes, is it safe to do this? When can I go do that? What do you think if my family wants to go do this thing? And there's not yes and no answers to most of those questions. It's really thinking about what is the level of risk that you're taking? What is the level of risk that you're comfortable with for your own situation? And then also, what are the things that you could do to decrease the risk with whatever activity it is you're asking about? So I like this because it kind of shows a scale of, the very safest thing is if you never left your house ever and you were just with your family members. One of the more risky things would be long gatherings indoors at like a concert or a stadium. But there's a lot of things that are in between, and then there's a lot of things we can do to make any of these activities more safe, like masks, like distancing, like cleaning our hands, decreasing the number of people, doing things outside instead of inside when you can. So just remembering that everything is a scale and that you want to think about the different risks you're taking throughout your day. All right, so the school guidance, the nitty-gritty and less fun part. So I want to start by overview of what CDPHE has put in place for Colorado's framework of thinking about COVID risk. So back in March and parts of April, we were in stay at home. This meant everybody was really told to keep in their home unless they were going out to do necessary things, if they were an essential worker, a critical business where they needed to go work in person or needed to go get groceries. Where we are now in most of the state is safer at home. So this is, still continuing to practice distancing, but many businesses are open, still encouraging people to be outside instead of inside. But again, allowing for more loosening of our activities. But you'll notice that things aren't the way that they were back in February. There's some parts of the state that are in Protect Our Neighbors, and this is where the county or local public health agency can apply for Protect Our Neighbors status once they show that they have the ability to respond to cases if they were to occur and that their numbers are down to a very manageable level. In this Protect Our Neighbors status, this would be things like opening up a lot more indoor dining capacity or allowing larger events at churches or things like that. So we're spending much of our time right now between levels 2 and 3, depending on where you are in the state. Symptom screening relates a little bit to those 2 different levels. So for symptom screening, what you want to do is check each day with your kid and with yourself too, and say, am I having any of these symptoms? And if your child is having any of these symptoms, they should stay home, call the school, and call your doctor to help sort out what might be going on. When we're in low community transmission, which is Protect Our Neighbors, so a lot of the state has gotten this low or is pretty close to it. You just need to look for high risk or major symptoms, and those would be the reasons to stay home right away. The high risk symptoms are in this top light blue box. So fever, chills, cough, shortness of breath or trouble breathing, and then loss of taste or smell. We know that not every child is going to be able to tell you about taste or smell reliably, but if they do say that they can't taste or smell something, that's an important symptom to keep an eye out for. When we're in sustained community transmission, so safer at home or stay at home, and again, stay at home was the highest level of COVID and where we were all stuck in our houses, you want to look for major symptoms and minor symptoms. So these minor or lower risk symptoms, unfortunately, include a lot of common things. So sore throat, runny nose, muscle aches, headache, fatigue or feeling very tired, abdominal pain, vomiting, or diarrhea. If you have any of those, you should call your school, stay home, and talk it through. It may not mean that you have to go get a COVID test, but it does mean that you're going to have to check in with your school nurse and check in probably with your primary care doctor to sort out what might be causing those symptoms, particularly if those symptoms are lasting for more than a day or two. And then finally, in this big red box, if your child has had close contact with someone who has COVID in the past 14 days, they need to stay home from school, and they really should be staying home to quarantine in general. So what does it look like after somebody has these symptoms? This is from State Health from CDPHE. It's a very busy diagram, and I'm not going to go through all of it, but I just want to share it with you so you understand that these plans have been thought about. People have spent a lot of time on these, gotten a lot of input from school health nurses, as well as some input from schools. There's two different sides of this chart. So this first one is in low community transmission, so in that protect our neighbors stage. And for this stage, if a child has symptoms and they resolve, they go away within 24 hours, you would say yes, they can go back to school following normal precautions. So this would mean if they have a sore throat and your school would usually ask you to get a strep test, that would have to happen. Or if they have pink eye and might need a note from the doctor, that would have to happen, but it would follow the regular non-COVID things. If the symptoms continue for more than a day, then you go over here and your school nurse is going to look and see, did this child get a PCR test? If the answer is no, which it might be, and that might be okay, then they're going to say, is there another explanation for these symptoms? Did their doctor say that it is food poisoning if they had vomiting? Or, is it a cough, but we know that they have asthma, and this is something that happened when they were out doing sports, and it went away after they relaxed after their soccer practice. So if there's an alternate explanation, then again, they can go back to school following the regular precautions. If there was no alternate explanation and they had not had a test yet, then they need to stay home or they need to go get a test. So this is in low community transmission. Again, you're not expected to know any of this as a parent. This is where talking to your school nurse as well as talking to your primary care doctor will be helpful. This one is for sustained community transmission. So this is when there's more COVID out in the community. Here, we still ask, okay, did the symptoms go away within 24 hours? And if they did, then that kid can go back to school following the regular procedures. If it's been 24 hours and the symptoms haven't gone away, then you say, okay, what kind of symptoms were these? If they were only minor symptoms, so again, the minor symptoms were things like sore throat, runny nose, muscle aches, vomiting, diarrhea, nausea. If they were only minor symptoms, and they went away within 48 hours, so 2 days, and they've been away and the child can wear a mask, then they can go back to school without a test. If they had only those minor symptoms, but they're still continuing, or if they had major symptoms, then they really need to go get a PCR test. And this is really to help keep everybody in school safe. And because it's important to know actually if that child has COVID or not for you and your family. So a child who's having symptoms that are lasting more than 2 days or having major symptoms probably should go get a test when there's high levels of COVID in the community. And that would be important, again, both for the kid and for school. I want to go over this common question and then I will wrap up. So I get a lot of questions from people about what I call friend of a friend scenarios. So this is where people will ask, well, someone in my house was exposed to someone with COVID-19. Does my kid have to stay home now? So if the kid was also in close contact or exposed to that person who had COVID-19, then yes, the child should quarantine and stay home. But say the situation is that this child's father was exposed to someone with COVID at work. Dad's feeling fine, but they want to know, can my kid go to school? So here, somebody at work tested positive for COVID, person A. Dad was a close contact to that person. They were working right next to each other and their cubicles were too close maybe. Dad needs to stay home and quarantine for 14 days. But the kid doesn't need to quarantine right now. He hasn't been at work around this person with dad. If dad starts to get sick, person B here, dad needs to go get a COVID test. And at that point, if dad is getting sick or if dad tests positive, then the kid would need to stay home, but not right away just because dad has been exposed. This is my last slide. This is where you can stay up to date with COVID information. So the CDPHE, our state health website, is updated daily at 4 o'clock with case counts and information about testing. You can also see county level information to get more local testing result information. And then checking with your local public health department's website and social media to see what updates they offer on a more local level. And finally, our children's website at childrenscolorado.org/coronavirus has a great list of resources about COVID testing and COVID in schools. And I will finish there and we can answer questions now, or I will let Brandon.
Hey, thank you, Dr. Cataldi. I think Aaron's been collecting a few questions from parents. Maybe we have time for one or two, and the rest we can push out in our newsletter.
I put a couple of them in chat. Do we have evidence of schools that have done this well?
It's a great question. So at the local level in Colorado, we're just starting to learn about this, but we do have evidence from around the world of places this has gone well, and it's mostly places who've gotten down to a low level of transmission in the community before they opened, places who used things like mask and distancing and used cohorts. We also have some information from early in the pandemic when there were kids who were in school because we didn't even know COVID was happening. And actually the amount of spread from those kids was not very high. So there's some good information from Australia about 15 kids who were in different schools and childcares. And the number of people who got infected in school was very low, even though they were in a situation where they weren't doing a lot of things like masks. So that's not a chance we want to take, but it is helpful to know.
Another question that came in is if you're considering conjunctivitis as a common infection, should we be concerned that conjunctivitis secretions would carry the COVID-19 virus?
So we've not found that eye secretions are a common way to transmit COVID person to person. And conjunctivitis, so red eyes or pink eyes, is a very uncommon symptom of COVID. It happens, it's been described, but it's mostly in adults and it's mostly in people who are very sick in the hospital or in the intensive care unit. And so a kid with conjunctivitis really much more likely has a non-COVID cause of conjunctivitis, particularly if they are well enough to be at home.
Let's see. How much less reliable are rapid tests percentage-wise?
So my favorite answer, it depends. And that's one of the hardest parts actually, is that for rapid tests, it's a really huge range. It can be anywhere from 50 to 85% sensitive. And what sensitive means is if the virus is really there, you'll catch it 50% to 85% of the time. So a coin toss is horrible and not something I would be excited about for a COVID test. 85% is pretty good. It's not high enough for us at the hospital to say, yeah, we feel good about this test. You still need a PCR. but it's high enough that it might be worth doing the test first. And then if it's negative and you're still worried, you could go get a PCR. But unfortunately, there's a lot of variability.
And then just to confirm, 100.4 is the benchmark temperature?
Yep, that's what we would use for a fever.
Okay, great, thank you.
Well, thank you.
Welcome to KYD.
Appreciate your time, Kelly and Dr. Cataldi. And we'll, if there's any more questions that pop up, we'll be emailing you. And thanks for your guidance. We've been part of their summer webinar series on a regular basis, learning as we go and updating our information. And that's the plan moving forward, is stay in close contact, understand the world we're in, and move quickly and change as things present themselves. And so I think we're in good hands. Thank you for joining us.
Thank you for inviting us. And
Thank you. Hey, Jack, are you ready? I'm going to introduce Jack Llewellyn. He's our MPA board president. He has a few things to say.
Okay, now I am. Sorry for the really great video here. I had some knee surgery this afternoon, so I am laying in the dark with a small light. So forgive that, and I'll keep this really short. You know, what the board, I think, wants the community to know first and foremost is that our job, as we see it, is to provide support and, on occasion, guidance to the administration and the staff, and then let them do what they do really, really well. And the job that they have done, from Brian all the way down, everybody, you know, the maintenance people, you know, everybody at the school, all of the staff, all of the teachers have just done an amazing job. And, you know, we couldn't be prouder of the job that's being done, and, you know, how we've been able to come together as a community. And going forward, I think that what we have been able to put together for the community is a safe and effective way for your kids to go to school in whatever manner you deem most appropriate for you, your kids, and your family. And, you know, that's going to be different for every family, maybe different for every kid based upon your needs. But with the remote options available and everything that Brian and the staff is putting together, we think that you're going to have a school year that has some certainty to it, that allows for safe education and really does provide for a quality education for your children, whether that's in person or remote, depending on what you choose. And really, I think that's all you need to hear from me. So I'll turn it back over to Brian. I do want to say, you know, we on the board are always available. If you have questions, concerns, our information is on the website. Feel free to reach out at any time about almost anything. And it's yours, Brian.
Thanks, Jack. Appreciate the time. All right, we're going to jump back into the slideshow here. And the restart plan, the big document, we're not going to go over it page by page tonight. That's there as a resource. I'm going to hit some highlights. And I really want some time dedicated to some of the staff members so you can kind of hear from them, because, you know, I've been on all summer talking to you. So it's good to hear what's going on actually in the schools or in the classrooms. The numbers have changed. We have these two models, and of course we're going to be back in the classroom in person. I don't know, I shouldn't call it traditional, it's Montessori. But at one point we were at 92% of families wanted that option. Now we're only at 80. Remote has jumped up to 20%, and we had to make some changes. We had to move some staff around to accommodate that. That's really hard to have teachers try to do in-person teaching and remote at the same time. That would be like asking an airline pilot to fly a plane and instruct students on the ground at the same time. Really hard to have strict protocols. Be really hard to have health and safety at the forefront. So we have to divide and conquer. We have to have people who can handle the remote because the guidelines are strict this year. At the board meeting last night, we had to adopt what's called the educational process resolution. And that basically means our remote program, our remote learning is just as stringent as our in-person. The minutes, the time, the check-in, the attendance. What we did in the spring was kind of like, hey, give it a try. That's not going to work with the state of Colorado. And so we got to have a much more in-depth remote program. And so that's why we had to move staff around for that. So we'll update you more as we go. Just keep in mind, the last time we talked, we had a different start date. We moved ours back, partly because Jeffco did, because some of our teachers here have children in other Jeffco schools, and if we started earlier than them, and now we have childcare issues. But really, the main reason is being a charter school, we don't rely on all the district services. Our maintenance is our maintenance. Everything really kind of falls on a very small team over the summer. And we need to navigate that. And especially Montessori is a different learning environment than other schools. And we wanted to take our time and build the right way to do this, because if we don't, you heard, you make mistakes, they close schools down, they close businesses down. So we've taken our time, we've done our homework, and I think we have a really good system of doing things. We're going to go over that. So remote starts this coming Monday, the 24th. And everyone's remote for a couple weeks. And then, as Jack said, we're committed to starting on the 8th. So we will start on the 8th K6, 9th for preschool. If you are choosing, say you made your choice with us and you kind of see how the world goes and you want to change, we're trying to use these change dates so that we can adjust our programming, because if we have too many people changing their mind all the time, there's no way we can have safe cohorts in our classrooms or the ability to adjust. I can't have Mr. Todd, who's doing our upper remote, have a huge giant group. That's just no way he can do 50 kids, okay? Same with Miss Angie at lower, and also Miss Jill at primary. So we have to have balance in what we do, and we have to have time to make those adjustments. So thank you, parents, for helping us out and getting your choices into us. Just real quick, the restart plan, we with Children's thought about how we're going to do this health checks. And you see in the news all these health check stations at the front of schools. We felt as a charter, the relationship we have with parents, the way we do car line, how we have greeters, we're going to do home self-screening. So that means I'm going to have 7 people out front in the mornings. You roll in at your staggered time. Remember, we got to break up our population a little bit so that we can adjust. And you hand us your health form, and I'll show you that in a minute. We check it. Your kiddo puts the mask on. Okay, have your mask on in the car, parents, and they walk into school. We learned a valuable lesson when the staff came back on. A lot of teachers didn't have the self-check form done from home. Guess what happened out front? We got 30 people outside my office window. And anytime you line people up, social distancing starts to break down. So we learned very quickly that we need to do this in a way that parents, you can get to work quickly on time. So if you do your part, we'll do our part. The greeting at the curb is going to be as always, friendly and fun. We'll check the health right there with the form. You're good to go. And you get off to work or where you need to go, and the student walks in the door and we're off to learning. So masks are on when they enter the door. And then once they get to the classroom, the teachers will take the mask thing from there. Okay. And I have this little bullet there that says, trust teachers to guide students how and when to use the mask. We could really get into the rules on who's 10, who's not 10. It really comes down to this. Everyone who walks in the building here, staff and student, parents, sorry, you have to stay out because we're going to try to minimize all the adults in the building. That'll keep the building with less people. That's the point. It's not that we're unfriendly, it's just that is best at this point, staff and students. And then we're in cohorts. Cohorts are king. They walk in to the building with a mask, students. Once they get to their classroom, the teacher takes it from there. So it's very simple for us, masks in the hallway, masks when we're moving. Anytime social distance breaks down, that's the time to put the mask on. Of course, we will work with exceptions. We'll work with the families that have concerns. That's how we do things. But if we run a strict protocol, we will be able to keep the building open. It's when we fail at protocols and the health protocols is when we'll close, okay? And that's all over the media. I've done like what Dr. Cataldi does. I study what works and doesn't work. I call people. The charters and the other schools that are still running, who've been open longer in the month of August, it's all about what you monitor gets done. And that is a line from my principal training. What you monitor gets done. And right now, my shift is, are we following protocols? And that's it in a nutshell. We're just going to be safe and we want to stay open. And we want our staff healthy so they can provide remote teaching and in-person teaching. Once people start to get sick, the whole system starts to break down. Let me switch over on my sharing just real quick. I wanted to show, whoops. Let's see here. I wanted to show, I got to adjust here. There we go. So you probably saw all the flow charts. Well, here's the health screener. So when parents, you come and get the supplies starting tomorrow. Some of you had visits today. Students came and worked with teachers in person today. You're going to get these health screeners. So do your homework, do these at home, fill them out prior to car line. Your life will be easy, quick, and gone. If you forget, then you're probably gonna have to go back home and take care of it because we're not running health stations out front. We are not like Jeffco in that regard. So that's the partnership that we need to have is staff comes with this also. They have to check in. We review them all. Anyone that might have any kind of concern, we follow up with staff. Same with children. If we notice any kind of information on here, and we may be calling you, but this is the ticket to school. That's the way I view it. Next are these flow charts. I'll be working very closely with Christine. So will Veronica and Amy here in the office. And we have kind of a triple approach to this. We have Children's Hospital. I have my resources at Jeffco County Schools. They will help us. And then we have our own expertise. We get to know kids. We know their health. And so I think between those three ways of looking at children, then we can kind of make these charts not as confusing because we don't want to shut the school down over runny noses, okay? Things like that. So we're going to take it in a multi-step approach so that we make the right decision and you're included in that conversation. The other thing, just real quick, of course, these documents are linked into our restart plan. The restart plan, I'm hoping, Brandon, this works when I scroll. This is kind of new. See if it scrolls okay. Okay, thank you. I really wanted to talk about the car line and how this is going to work. We do have 2 staggered times, and I've been getting emails, well, I don't know if that time works or not. Well, like I said, we're family here. If something, I know some families have pickups at other schools, things like this, contact your lead teacher, talk it through, because what we have to do is we have the benefit of having 2 adults in a classroom here, right? We have a lead and assistant. So if you're in the elementary section, so 1st grade through 6th grade on this side of the building, one staff member has to take half the students up for the first wave. So this is morning, sorry, I'm talking after school. So on dismissal, and the other one's still in the room. And then when it's second wave time at 3:10, the second group comes up. Over here in the primary wing, we will have pickup of kinders, like we've done in the past. Preschoolers will get picked up at the classroom doors. So parents, you have to park, and then we have the sidewalks and you can walk up. So it should be very efficient. I don't think it's going to be any longer. Obviously, the first couple of days, keep in mind, things always go longer than expected. Morning, same process as we've seen in the past, just no adults can come in the building. So again, if you're a primary preschooler kinder, park your car, walk your kiddos up, drop them off at the doors. If you're a family that has multiple kids, again, park your car, and we'll have a station out front for 1st through 6th, and that staff member will have those kids come through the front door, and then you're welcome to walk your kinder or preschooler up to the building. So again, try to abide by the wave times. We start at 7:50 to 8, first wave, A through M, and second wave, 8 to 8:10. Probably at maybe mid-year where everything's working, we might flip that so that we can balance our time with students, because the state does count the minutes. Okay, so it's just something that we will look at the status of where we're at with schools being open. Again, we will update things as we go. Very happy with everyone who's chipped in to make this kind of document, and it really worked out nice. Couple of things I just want, this is one thing that's not in the restart plan, and that is how we're going to handle travel going forward. Domestic travel, you know, you got to go off to somewhere, come back. As long as you're healthy according to that screener I showed, and everything seems okay, you can return to school. Okay. Any symptoms pop up, major or minor. If they're major, obviously start talking to your doctor. If they're minor, please call Christine here at the school and talk it through. International travel, that's a biggie though, for all staff and students. Say you're going somewhere over the holidays, at this point in time, you would have to quarantine for 14 days. So obviously my winter trips got canceled way early on, but I just want parents, especially parents, to be aware of any travel plans and how that might affect their return to school. So with that, I'm going to introduce Miss Heidi. She's one of our primary lead teachers, and she's going to talk to you about what's going on there. Take it away, Miss Heidi.
Well, hello there, everybody. We are so excited to be back in school. My name's Miss Heidi, and I am one of our lead teachers in the primary wing here at MPA. And we just wanted to welcome all of our new families and welcome back all of our returning families. And also, we just wanted to give you guys a big thank you for all of your support and your trust in us as we prepare to welcome your children back to school. As a team, I just wanted to let you know that as a team, our primary group voted unanimously that we wanted to return to school and be with your kids. So I just wanted to let you all know that. We're eager and super excited to see them. It's been too long. With that said, though, we do have our wonderful Miss Jill Modis is going to be our distance learning teacher. She'll be our full-time distance learning teacher for primary. I wanted to just clarify something maybe with Brian. I'm not absolutely sure, but you had said, Brian, that distance learning teachers would start on September 8th. Is that true?
Well,
I think Jill was thinking she was starting Monday. I just wanted to double check on that.
well, yeah, in person starts September 8th and 9th, but distance learning continues.
Yes, okay, got it.
So we have a little difference up at lower and upper because Mr. Todd will be running upper, so he'll be involved the next 2 weeks, but then he keeps teaching. But Miss Angie, since she doesn't have a full class herself, she will be a part of classroom Zooms and stuff for first 2 weeks, and then she takes over the remote teaching for those remote students after that with frequent check-ins with the regular class. So each level's a little different. So thanks for clarifying, Heidi.
Sure. So then I will clarify that Miss Jill is starting her her full distance learning class on Monday morning. So look out for her emails to you. And so I know she's been calling a lot of you. So just keep an eye on her emails, please. We also want to welcome Miss D as her assistant and our primary floater this year. Welcome to Miss D. And we have a couple of other staff changes. We want to welcome very warmly Miss Erin, who is our new primary teacher. She's our new primary lead, and things are going so smoothly. I am just super excited about this wonderful team that we have in primary down here. Miss Lucina will become, has already been working with Miss Erin as her full-time assistant. So moving on, I just wanted to talk about tomorrow morning, Thursday morning, we're going to start that curbside greeting and materials pickup. I did have a couple of families reach out and wanted clarification for that today. And yes, we have a packet for every single child. So we have something for all preschoolers and for kindergartners for tomorrow. So remember that if your last names begin with the letters A to M, you're going to be between 7:30 and 8:30. And if your last name begins with N through Z, you'll be coming from 8:30 to 9:30 through our kindergarten loop. Also, if you have a older sibling, that your child has an older sibling in the elementary wing, you're going to come through our kindergarten loop first, and then you will just go right on in through the elementary loop to do that pickup as well. Okay, so I wanted to let you know too that at that same time, if you have I don't know what it's called exactly, but some kind of an assigned agreement that Miss Heather sent out for a Chromebook, that would be a time for you to let us know there at the curb and hand us that agreement form that you've already signed, and we will hand you a Chromebook and sign it out to you. I need to let you know that if you don't have that form signed, we won't be able to hand you a Chromebook right then. However, Ms. Heather has said that if there are issues with that, we can make an arrangement to have you pick it up sometime next week. So that's what I have about that for now. I also want to just make sure that all of you double check Jeffco Connect, and please make sure that your email is up to date, and that if you want more than one email on there, that it's there, because most of our staff or a lot of us use School Messenger, and whatever email you have there on the Jeffco Connect will be the one that we are sending emails and communication to. Speaking of communication, I think, along with flexibility this year, communication is going to be absolutely key, and you'll be getting a lot of communications from the MPA office as well as from your individual teachers. So please, please check your emails regularly, read them carefully. I try not to be too wordy, but I give you a lot of information, and I know other teachers do too. So please save those for future reference. Also remember that lots of information, but plans still are evolving. So keep checking for changes and updates from your teachers. No question is a silly one. So please reach out to your teacher if you need any questions answered, if you're concerned or have any ideas you need to share. One really important thing for our primary kiddos, tomorrow, Thursday at 1 o'clock, each teacher is doing their own class Zoom. And so you should be on the lookout, if you have not already received it, for a Zoom invitation for a meet and greet and question and answer for parents. So each of us will be there to, if questions haven't been answered tonight or through email, you can ask us then, and it won't be the last time. Also, I just wanted to mention one last thing, and that is that kindergartners, we always do a DIBELS assessment, and we try to do that at the beginning of the year. As our lovely Miss Kristen Snow said, she says that the gold standard for DIBELS is always to do it in person. And our window is open, but it's open for quite a while here. We have plenty of time to reach out to you and make sure that either we're having your child come in for DIBELS one-on-one, or we wait until September 8th and start that week. And so just keep an eye out for emails from your teachers, and hopefully that'll answer most of your questions tonight. And that's all I've got. Thank you, Mr. Bryan.
Ah, Miss Heidi, so good. She was nervous, but oh, you're professional. Love it.
Thanks so much.
Yeah, that just shows you the level we're at as a staff. They really have thought through these. And so now it's Miss Jennifer, if I can get the slide to go. And oops, went too far. There you go, Miss Jennifer, take it away.
Okay, thank you. I want to just echo what Heidi said. Thank you for joining us tonight and taking the time to listen and to learn what we know today on August 19th at now 8 o'clock. And for being flexible and kind with all of us as we navigate these changes. We're all working really hard to remain true to our Montessori foundation and to be flexible with the changing environment. Flexibility, like Heidi also said, has definitely been the word of the week and beyond. Mr. Bryan mentioned Gumby in in passing earlier this week, and I don't know if anybody else is old enough to remember Gumby, but that made me smile and keeps me smiling. Staff updates for lower elementary. We have 4 new assistants. You might know about these already, but Miss Emily Bushman is my new assistant, very excited. Miss Melissa Brankert and Mr. Jeremy Stevens are new in Miss Aaron's room, and then Miss Amy is new in Miss Darcy's room. And then we also have Miss Morgan Warren. She's our new lead. Joining our team, she'll be working with Miss Elizabeth. She's wonderful. She has a lot to offer. We're excited to have her. She has scheduled several meetings with her students so that she can meet everybody before school starts, since she's new to everyone. So in an effort to give her that space, most of us lower L teachers are meeting in smaller groups and or meeting next week. And then Miss Angie Mackey is our lower elementary remote learning support teacher. And correct me if I'm wrong, Mr. Bryan, but Miss Angie is going to be working with our remote learners and us as teachers and supporting both sides of that equation. You're fully, that's correct, right, Mr. Bryan?
Yes.
Good. Your fully remote learning students will have her support, but they'll also be part of our classroom. And that's an important piece for each of us in the lower elementary, is to maintain that classroom, at least at this point. So, and like we said, everything about this is new. When we identify a need, we'll work to change it or to fix it. Flexibility is the key. Communication from your teachers. Every lower elementary teacher has communicated with her class, and we're working on ways to meet new students, to conduct assessments. Ms. Heidi mentioned the DIBELS testing. We really do want to try to do those in person, and hopefully you'll hear from your teachers in the next couple weeks, or we'll start doing them after September 8th. You'll also hear about back to school night kind of Zooms. And all of us are starting with a morning meeting this coming Monday. And again, like Heidi said, if you have not heard from your teacher, please check spam, check Jeffco Connect, make sure it's an email address that you check regularly. And if all that's in order, directly contact your teacher, and we'll make sure that that we get you the information you need. Nobody wants to miss out on information. And then again, to clarify, Thursday materials pickup, the curbside greeting. All the lower elementary teachers have materials for you to support the lessons in the next few weeks. So please come by and pick those up. And if Thursday morning doesn't work for you, contact your teacher. We'll set something else up. My information about Chromebooks is that if you've already filled out the tech agreement, we will have a Chromebook ready for you tomorrow. If you don't have that agreement filled out already, please contact Miss Heather and she'll make arrangements to get you one probably early next week. And then finally, as a team, we are proud to be part of this community, and we're collaborating in ways like we never have before. Even in this time of social distancing, it has brought us closer together. Dr. Montessori's voice was at the forefront of our minds and our work as we provide for you, our community, the safest possible prepared environment. Especially during this time that we are all experiencing, we look to Dr. Montessori, who reminds us that this age group relies on the inspired imagination to grow and to thrive. And as she said, imagination does not become great until human beings, given the courage and the strength, use it to create. So we keep Montessori at our heart. Thank you.
Well done, Miss Jennifer. Thank you. You can see, parents, how inspired I am every day when I come in. There's just a sense of calm. We have this presence of we got this, but we're going to do it in a way that's safe for everyone. So thank you. And now we have Upper. Miss Ashley, take it away.
Hi, thank you guys. Thank you so much for coming tonight virtually. A lot of things I'm echoing from Heidi and Jennifer. The sentiment towards parents is the same. And my team also wanted to express not just their thanks for your support, but for your trust. There have been so many changes and things, just new information coming out. It's a lot to take in, and we understand that. And it's a relief when we make a big change and put out a new announcement that we don't get flooded with emails. So thank you for just trusting that this is all going to work out. And again, we just really appreciate that you know your kids are in good hands with us. For Upper L, we a few staff changes. Mr. Todd is our remote teacher for Upper L. He has his cohort for Upper L students. However, those students are still registered in your regular classes. So I have 4 students who are remote. They're still in my class. They will come to my morning meetings, and each teacher will collaborate with Todd on what they might want to be doing with that child, and it may be different for each child. So if your child is remote in Upper L, definitely communicate with your teacher and then also with Mr. Todd, and you can find out what that blend is going to be. So we're still involved with those kids. So that, yeah, Mr. Todd. So Miss Karen is leading Mr. Todd's class. He is remotely with her. So they're a pair. Miss Tasha is now with Miss Natalie. They're rocking it. I think they got their room set up first. Awesome. And then of course I'm with Miss Treba, and Liz is with Miss Tanya, and Jen now has Miss Carola with her. So Upper L has become pros at moving people around to be where they can be at their best and support each other. It's just been amazing. I'm very proud of my team for what they've been able to do and just jumping right on it and not freaking out. So that's been awesome. We are going to be doing starting Monday, we'll be doing our morning meetings. You can find out from your teacher which group you're in. You might be in 8:15, you might be in 8:30. My class is in 8:30. And if anything changes, you'll get information from your teachers. I want to echo one thing that Jennifer said about checking your email. I pull parent information off of campus that comes from the district. And it wasn't that it was an incorrect email, it was one that they weren't really using, or, oh, I don't check that one. So like she said, please make sure that the emails for you are the ones you want to use, because we cut them, paste them, put them in, and make sure, because those are the ones that were entered, and we want to make sure everybody's getting the information. Check all your school emails. I know there's a lot. Check your MPA emails, check your teacher emails. Like we said, things change. We'd rather you be up to date on the changes than figure it out and you not get it in a timely manner. So check your mail, especially coming up over this weekend, so you'll know what to expect on Monday. Again, tomorrow's curbside pickup for supplies, 7:30 to 9:30. You're either an A through M or an N through Z, unless you've made arrangements with us. For my class in particular, my 4th graders and my 2 new students, they're already covered. So if you came today, you do not have to come to that. You've got all your supplies already. Let's see, sorry. Yep, got that. Teachers are currently updating their Google Classroom, their websites. Things are changing all the time. We get new information. We're trying to put new links and get stuff together. I thank you. A few people reached out and let me know that one of my lists was not available. So I'm going to make sure that gets out to people. Just let us know. They're like, hey, I can't find that link, or I didn't see something. Keep us posted, because we are building those as we speak. So just let us know if you need some help with anything, and we'll pull this together before Monday. One thing I enjoyed today with my 4th graders is, as they came in the room, there was the talk started with, well, we're going to be in the room, but well, we can't do this. Well, we can't do this. And I stopped myself and I told the child in front of me, I said, you know what? Let's not say that. Let's not say we can't. Let's figure out, well, what can we do? So we'll look around. What can we do? How can we fist bump? Can we stand across from each other? How are we going to move around here? How do we handle lunch? And instead of thinking about, well, now we can't, what can we do? And that gives the children a lot of ownership and thinking about it. How can we make this work? And they really enjoyed that. And they started looking at everything in the room in a different way. So your kids are great. They know what's going on. They're all cooperating. They know the mask protocol. So Upper L is in really good shape with that. And we thank you for preparing your kids so well with this. And let us know if you have any further questions. Thank you, Mr. Bryan.
Thank you, Miss Ashley. Again, they are working, they got a plan, and it was great to see students coming in and working with those teachers today as they're walking past my office. So, hey, this is real, and that's it. So now Miss Jan is going to update homeschool. So take it away.
Hi, everyone. Of course, thank you so much for coming. We're so excited to welcome you back this year. We've missed you so much. It's not even funny. The teachers are all ready, and it's been a lot of fun to prepare, even if it's a different environment. So today we started our meet and greets, and that was listed in our big email that went out. So if you've seen that, it's also on our homepage for our website. But there's more meet and greets on Friday in case you still wanted to come in and say hello to us in person. So that was really great to see families in person. Also, right now, we have new families joining us. So welcome if you're on this Zoom for brand new families, and then welcome back to all of our returning families. We so appreciate the fact that you have put your strength and trust into us, because this is a big shift. And we know that our program is purely enrichment, and us providing that service to you has been nothing but an honor, knowing that you want to participate. Last year, Mr. Bryan passed out these fun little love bombs, if you can see it. And the back of this one says, I really appreciate everything you've taught me. I've been in our homeschool community now for 12 years. I taught for 10 of those, and I've been directing for 7. And getting to support these homeschooling families has given me the confidence to support you further in this journey. So we're in it and we're ready. To the important information, we do fall under Jeffco, and we do fall under the Montessori Peaks Restart Plan that is linked in that email and also on our homepage. Our classrooms are ready. We are clean. We are excited. Our teachers have been there for in-service for the week. It's a little more sparse than what you may have seen, but that just gives us the space to really spread out and to keep everything going the way that needs to go for the day. We plan on spending a lot of time outdoors, and we plan on being in the classrooms some too, especially as it gets colder. So that gives us more than enough space with classrooms up to 15 to maybe 18 students here and there. Homeschool remote starts August 21st. And the reason is we need to make sure we fulfill our hours and days for the district as well. And then after that, we go to in-person the week of September 8th. So a quick rundown of our programs and when we start. So Friday is the Connections program start remotely. And then the following week, our Options program for Tuesday and Wednesday start remotely. Connections gets 3 weeks, Options gets 2 weeks, and then we're all back in person, fingers crossed. And so our remote this year will be a little bit different than our crisis learning remote, how we started back in March. So what we're going to do is we are going to be developing a Google Classroom for a little bit more classroom privacy and keeping the organization of our information to you clear per class. We will be offering Zoom tutoring for you guys to learn how to do that and put that together, working with your specific lead guide. I promise it's not hard, and it will be a little bit more simple than trying to keep up with emails and chasing this and chasing that and keeping up with the activities that we're going to be sending out each week. So we'll learn together a little bit. Some of our families have chosen to stay remote permanently throughout at least this semester. If you choose, as for your remote family, to come back to us in person, fantastic. We will also be following those 3 dates put out in the Restart Guide for an easy transition. If there is a different date that you need something specific, again, we're family, communicate, we'll figure it out. I did send out the big email last Friday. Our main way of communicating is going to be digital. We're trying to do the least amount of paper possible, 1, because we want to save the planet, but 2, it's hard to keep up with paperwork when we're not in person. So we're going to be sending out most of it as remote and digital as possible. If you are on the fence and you're not sure what you want to do right now to continue exactly what you're thinking and what your needs are as a family, we fully understand, but I'd love to chat with you about it. So please do reach out, and we'll see what we can do, if we can do anything. There's been a lot of transition. We have a bunch of new families. Some families have chosen other things. We're really excited about the year in general. This year's, we're also really excited because the school bought the North Campus, the previous Praise Church. We will be building out. We will be planning some new things for next year. And so Mr. Brian and I and the building committee team are going to be working very closely on putting some of those plans together. And as that develops, we'll put out some information, probably starting second semester, to see how things go. So we also are offering a Zoom tomorrow night at 6 o'clock for all of our homeschool families to have a voice and be able to speak directly to myself and our guides. Miss Sherry, Miss Melissa, and Miss Lori, our music teacher, will be there as well. That way you can speak directly to us, ask any questions, voice your concerns, whatever you need to do. We want to maintain our strong community feel and talk about anything back to school or anything that happens. So that information, that Zoom link, was also in that email and is also on our homepage on the website. We also added a small remote learning section that will talk about what our remote learning will look like throughout, at least through September 8th, and then if you continue on, etc. What did I forget? We have no staffing changes, which is fantastic for our small group. So welcome back to everyone, and we're ready. We're excited to see everybody. If you need anything, please email me or give me a call, and we'll be around, and we are ready to go. So welcome and thank you.
Nice job, Miss Jana. Yes, they are ready. In fact, they're ready this Friday. So again, they've done a marvelous job of recrafting that program and being flexible, and again, addressing parents' concerns and needs. And thank you, Jana and the team. Folks, I really had a goal of trying to wrap this up by 8:30, so I'm going to speed through a few things here. Food service, a little bit different this year. Miss Shannon, when food service returns on the 8th, it's delivered directly to the classroom now. And what will happen is she'll hand it out. There'll be no servery pickup. We can't do any volunteers at this point. Sorry. I know that is the one thing that we really have struggled with, is we just can't have other adults in the building, and this school thrives on volunteers. But it is the world we're in. And if we can keep an open and safe school, we know in the future things will change. So Miss Shan's got to handle this in a very direct way with the students. This is for both breakfast and lunch. And now the menus will be turned in through a Google Doc. So watch for information from Miss Shannon. Before and after care, well, this has been a real struggle because we want to get good at opening a school first. So we're starting with remote, and we're going to go in person. Miss Lori's really working on switching up some of the licensing to give us a little bit more flexibility. Watch for more communication from her as this moves along. But first, we got to make sure we can run a safe school. Then we can start opening up before or and after care for the families that need it most. We cannot run the same size of program as in the past, which was a very big program. So we're going to have to kind of go on a need basis. And so watch for that information as things move along here. Again, volunteering and school tours are all on hold at this point. Again, your actions have been very helpful. I know some of you have reached out to our own MPA board. Some of you have reached out to Jeffco's board as well. All your questions. I really do apologize that I couldn't answer every single one. Just the volume was so immense. But I did read everything. I will get back to all those parents now that we have maybe information for your question. It might have just been a month early. So we'll always circle back and help out. But you helped shape and guide that MPA restart plan. So please understand your voice is in there. The board is involved in it. We have checks and balances to know whether we're doing the right work or not. We're not trying to open a school in an unsafe way. We'll be as safe as we can in the environment that we have. And if you still have concerns after tonight about your choice, please email Miss Veronica. We really have to lock in where we're at with our class list because too many changes starts to tip the apple cart. So if you're on the fence and you need to talk through something, you have your classroom, your lead teacher. You can also email Miss Veronica, and then at some point I'll probably get involved if we need further clarification on something. But I think we're getting very close. This is very exciting. And as always, we're going to do it with grace and courtesy. And let the kiddos know at home, Dewey's going to be making an appearance soon. So it'll just be a good way for reminders. Dewey's practicing some things, so watch for those videos coming out soon. Let's answer a few questions here, Miss Erin. What do you got?
Let's see. I think a lot of them we were able to get answered in chat, which is fantastic.
Nice.
There was a question for Miss Heidi, if she's still on. Are the Zoom meetings tomorrow at 1 p.m. for students and parents or only parents?
I think it's mostly a parents' question and answer time. Monday morning, we'll be meeting with all the students as a like a morning meeting, circle time. So we'll see our children then. Of course, if a little one happens to appear in our screen tomorrow, that's perfectly fine, right, Jana? I love that. Thanks for asking.
A question about for tomorrow, and this is kind of a primary question too. Anna would like to know if they need to bring their paperwork, health forms, copies of birth certificates, and all that kind of stuff with them to give to you at tomorrow's pickup.
That was not something we had planned or prepared on needing tomorrow. I think it's just come and, drive by, and we will, hold up your sign with your child's name on it and your teacher's name. And we will hand you your child's packet, and we'll hand you, if you have your tech form filled out, we will hand you your Chromebook. And Erin, you had just mentioned that I got an email from a parent who was interested in where the tech form is located so that they could fill it out. I'm not exactly sure, and I've been trying to find out just now. So if anyone knows right away, but otherwise I'm going to try to send it out tonight.
It is in a link it's in an email from Heather from a couple of days ago.
Okay, I'll check it out. Thank you.
And I tried to link it into the chat and it didn't work.
Okay, that's all right. I'll look for it tonight. Thank you.
Brian, can the meet and greet, there's a question about whether the meet and greets will be recorded and sent out to parents who are working at that time.
Yes. Let me circle back. Any registration stuff that parents have, that's handled through with Miss Veronica in the office. Obviously, this year, things have to be done digitally, through the internet, where we're not bringing parents into the office like in years past. So you have those questions about registration, all those documents, that Miss Veronica will help you through that. So don't panic. We got time. We'll get there. But we just have to do it in the safest way possible at this point. As far as the Zooms, yes, like the parent greet meets, I've been talking to staff members. Obviously, they're for adults. We understand if a little kiddo gets in the way, just please understand they are being recorded so that parents who do work can watch them later. So it's really, it's one of those protocols that the teachers will say and remind you they are being recorded. They're trying to make it the business of the classroom, things like that. So it's not really a learning session with students, but just be aware they are being recorded.
What is the absolute last day to make a decision regarding in-person versus remote?
Well, since we're starting on Monday, yeah, we were really hoping those would be kind of cleared up this week at the latest. So again, Miss Veronica knows, the ones that we're working with. Contact us. We have 2 days, and then we got to get things really kind of settled in. We have 2 weeks of remote to really get the building ready, get any kind of last signage, HVAC upgrades. We still have work to do on the building, so we'll be doing that. But teachers have that time to prepare for not only remote, but for in-person, which is a different way of doing things. So this extra time is very important, and that's why we really need these choices to be finalized by this Friday. So you heard it from me, this Friday.
I think the other questions are things we probably need to run by Children's Hospital, just to be sure.
Okay.
Just in case, just for me, if somebody missed it in Zoom, you do not need to bring your printed out form for your Chromebook tomorrow morning. We have all of that information digitally from Miss Heather, and we have your Chromebooks ready to go.
Yes, we're trying to make it as easy on you parents as possible. Again, what we miss, we will figure it out moving forward. So one step at a time. And anything else there, Miss Erin?
And again, if you didn't fill out the Chromebook, get the Chromebook form filled out. Contact Heather, our wonderful librarian, or your classroom teacher, and we'll make sure and get the link to that form to you.
Yes.
And I'm going to pop in and clarify real quick. Homeschool does not need to come tomorrow, Thursday, for any of the material drop off or pickup. We are all handling that separately, and we have nothing that you need to pick up unless you need a Chromebook. Please talk directly to your lead guide, again, in that big email. So just wanted to clarify that Thursday material pickup, homeschool does not need to worry about that.
Great. Thanks for that clarification. Well, it sounds like we did it. Nice job. Parents, I know there's more questions. We'll be passing or sending out in the newsletter, at least by Friday, any big questions that we need to find answers for. Again, we're here for you. The staff is here. We've been on duty for a while, and we're ready to get this thing started. So remember, we're in this together. Please do your part. We'll do our part. That way we can keep everyone healthy and safe and keep schools open as well. So it's in our power. It is our choice. And we need to do this together. So thank you for joining us. Until next time, enjoy visiting with your teachers moving forward. Thanks.